Lactation is the production of milk in female mammary glands, and occurs naturally during pregnancy and post-pregnancy breastfeeding. Women may want to induce lactation if they are planning on adopting a baby or if they agree to be a surrogate nurse for a baby whose biological mother cannot breastfeed. Lactation is governed by pituitary hormones, as opposed to ovarian hormones, and, therefore, any woman can stimulate lactation, regardless of her obstetric or gynecological history. You do not necessarily have to go to a doctor or to take any special medications to start producing your own breast milk. Just follow these instructions for how to induce lactation. Understand how induced lactation is possible. Although it may seem surprising, it is indeed possible for women who are not or have not been pregnant to produce breast milk. This is usually undertaken by a mother who wishes to feed her adopted baby. The body's production of breast milk is usually triggered by the complex interactions between three hormones, estrogen, progesterone and prolactin, during pregnancy. If the production of these hormones can be mimicked through physical stimulation and/or hormone supplements, then breast milk can be produced outside of pregnancy. Prolactin, the main hormone involved in milk production, is produced in the pituitary gland, not the ovaries. Therefore, it is possible for women to induce lactation even if their uterus has been removed. However, the induced lactation process is usually more successful in women who have previously been pregnant. The induced lactation process can take several months, so it is a good idea to begin the process as soon as you have an idea of your adopted baby's arrival date. Adoptive mothers have the greatest chance of their baby latching on successfully if the baby is younger than 3 months. Understand the pros and cons. Inducing the production of breast milk is a huge undertaking, so the pros and cons should be carefully weighed before any final decisions are made. Pros: obviously the main advantage of producing your own breast milk is the benefit it will have for the baby. Breast milk contains important antibodies, proteins, fats and vitamins that will help your baby to grow and gain weight, and fight off infections and disease. In addition, breastfeeding is a wonderful, intimate way for mother and baby to bond. This is especially true when the baby is adopted, as the bonding process can take time. This is also the most natural method of feeding your baby, and can eliminate the need to use store-bought formulas which may contain chemicals. Cons: the major drawbacks of induced lactation mainly involve the time and effort required to be successful. Stimulating the production of milk requires huge dedication and commitment, as breast pumping and stimulation needs to be performed 6 to 12 times a day, including nighttime sessions which involve waking up in the early AM. This process can be painful and uncomfortable on your breasts, and if you're using hormone therapies, you may experience mood swings and disruptions to your menstrual cycle. Increasing the volume of milk: take herbal supplements. Many women recommend herbal supplements to naturally increase the supply of breast. The most popular and effective herbs are fenugreek seed and blessed thistle herb. In terms of dosage, it is recommended that you take 3 capsules of fenugreek seed, containing 390 mg per capsule, and 3 capsules of blessed thistle herb, containing 610 mg per capsule, 3 times a day, with food. You should start taking these supplements as soon as you start pumping milk. You can also purchase an herbal tea known as Mother's Milk, which contains a blend fennel, coriander, fenugreek, blessed thistle and aniseed. It tastes like licorice and can be sweetened with honey or sugar, if desired. It should be drunk up to 3 times a day, directly before feedings. In addition to encouraging increased milk production, this tea may also help to reduce gas and colic symptoms in babies. Eat oatmeal. A common recommendation for breastfeeding mothers is to eat oatmeal in order to increase milk supply. There isn't much scientific evidence to explain why, but many breastfeeding moms notice an increase in their milk production on days when they eat oatmeal for breakfast. Some theories include the fact that oatmeal contains high levels of iron and helps to reduce cholesterol, both of which are important for healthy milk production. Aside from those reasons, oatmeal is a warming comfort food which provides lots of energy, 2 things that new mothers definitely need. Please subscribe to our channel and give this video thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.